We're delighted to have you here on Research Month. We've got a fantastic array of speakers who are going to tell us a little bit about the research pipeline. But I'll begin by just introducing myself. I'm Venora Hundley, Professor of Midwifery at Bournemouth University, and I'm the chair of the Research Strategic Policy Group. This month, we have the opportunity to really deliver the Council's 2030 policy. We're talking a lot about research, bringing research, education, practice together to support our member organizations. And one of the key things that people ask us is about getting into research. How do we get into research? How do we keep involved and engaged in research? And so today you're going to have the opportunity to hear the lived experience from 4 fabulous speakers talking about what it's like to get started in research and really the kind of key tips and things that will help you get going. So without further ado, I'd like to introduce our first speaker. Our first speaker is Vibiska Shahi, and Vibiska is a final year student mental health nurse at the University of Hertfordshire. And she's going to tell us a bit about her background and how research she got into research. So over to you, Vibiska.
Thank you, Professor Venora. Good afternoon, everyone. My name is Vibiska. I'm a final year mental health student nurse at the University of Hertfordshire. I'm also a proud 150 Leaders alumni of the Council of Deans of Health. Very grateful for the opportunity to be here and speak during the Council's Research Month 2026. I'll start by explaining a bit about my research experience so far as a mental health student nurse. I first properly came across the word research during my student leadership program. I came across this publication on becoming research confident by the council for undergraduate students, and it had slightly sparked my interest then in my first year. But the university did not facilitate research placement as part of the regular clinical placements, so I had to put that whole thought on hold for a while. During second year, I had a research and evidence-based nursing module, which I found difficult, and I'm sure a lot of my colleagues found as well. As any new concepts, it was big, complex words, which felt scary in the beginning, but as time went by, I started to enjoy the module. At the end of the second year, we were asked to find opportunity for elective placement, and just the right time, the university had resumed a research placement for all fields of nursing as opposed to adult nursing, which the university had done before, and applied and became the first mental health student nurse to be selected for the program. I enjoyed the research placement so much. I was shadowing so many ongoing clinical trials at the hospital. Coming from a mental health nursing background, shadowing gastrology, gastroenterology, renal, oncology, cardiovascular, so all new areas for me as coming from a mental health nursing background, and I had opportunities to learn so much about the physical health side of it as well. I had opportunity to meet researchers, speak to them, interview them about their projects, shadow pharmacists, shadow biomedical scientists in the lab, which I never thought was possible as a student. Following the placement, during my placement, I came across this internship program by the NIHR, hosted by the University of Staffordshire, and I applied straight away, even though it was 140 miles away and I did not drive. And I luckily got in, and I was able to do my 8-week internship program with the University of Staffordshire. I was involved in a few ongoing studies being done at the research team at Staffordshire University. I was able to have hands-on experience on data analysis for both qualitative and quantitative, and being involved in early stages of literature review, and transcribing data and report writing about our findings and observations from the analysis. This really gave me an insight of what a day-to-day work life as a researcher would be like. And whilst I got the exposure to clinical side, so frontline research delivery nursing, I also had the opportunity from this internship to see from a researcher's perspective. And coming back to my final year after the summer of internship, I was invited to be a guest speaker for children's nursing and mental health nursing for second year students, which was such a pleasure and privilege because my goal there was to speak about my experience as someone who had just gone through second year. And we had so many hands up for the questions. So many students wanted to chat to me later about the opportunity, and which was the best because in my second year, I did not have the opportunity. And just seeing that research interest come up in second year students was so fantastic. And um, also, I had the opportunity to present in NIHR celebration event after the internship earlier this March. And my next step is hopefully I've applied for a master's in research, health and social care, funded by the NIHR Insight program, and I'm waiting for the outcome. So these are the opportunities I've had so far in my undergraduate experience. And I had never thought before the research placement and the internship, never had I ever imagined I would be taking this path. I'd be looking forward to pursue this path. But yeah, I've sent my application, waiting for the outcome, and that's me for now. Thank you so much for listening.
That's fantastic, Rabiska, and it's great that you've kind of started us off with such an exciting introduction to research and real life research. It's often thought of as kind of a boring thing that people do in locked away. So that's a really lovely introduction to why we get started. Thank you. There will be questions. We'll wait for those at the end. But if people do have questions, please put them in the Q&A. Our next speaker is Anna Marsh. Anna is a midwifery manager in the antenatal services in the Newcastle upon Tyne Hospital.
Sorry, Venora, it's gone again. I really don't know what's happened. I'm so sorry. I don't know if you're using your headphones, but maybe try unplugging them and plugging back in, or maybe rejoin. But Anna, do you
I
maybe want
can
to
just
introduce yourself? And
no
yeah,
problem. Hi everyone, my name's Anna. I am a midwife. I'm 100% clinical working at the Newcastle NHS Foundation Trust at the moment. So I kind of fell into research. I'm not quite sure how I got here and how I'm still here, and I kind of think of myself primarily as a midwife, but also as a researcher, and those two fall hand in hand quite nicely, and have become something that I really enjoy and I'm really kind of passionate about, and I really hope that we can get other people into it, which is why I'm really happy to have been invited to this, and hopefully I can tell other people and get them inspired to join the club. So I, very similar to Rabiska, kind of got into research through my undergraduate degree. So we all had to do a mandatory literature review as part of our final dissertation, which I'll be honest in saying that I wasn't delighted about. I wasn't feeling very enthusiastic about. However, once I found a topic that I was interested in and kind of got the itch, I found that actually for me, research is something that's really interesting and is kind of ended up being woven throughout my career up until now. I've been a midwife for nearly 10 years now, and I'm still doing it, even though I said I would never after that first dissertation, but here we are. So my interest in research was looking at maternity in the media, and then that's kind of progressed into maternity services and social media. This has kind of been through a few bits and bobs, but fundamentally most of it's and lots of my drive was around being a clinician and just having a problem that I wanted fixing. So I was a midwife, I worked in the antenatal clinic, and I found that we weren't able to talk to women in a way that I wanted to, i.e. I wanted to be able to share updated visitor guidelines from COVID via social media. We made 20,000 leaflets about it, but I just felt they weren't getting to the women. And I thought the answer is that we tell them via social media. I went to my boss and they said, we can't do that. That's not policy. And actually, there's no research that that's going to help. So here I am 6 years later, still trying to make that research. So that's kind of been how my career has progressed. So I ended up being really fortunate in that I was supported by Venora, who's here, who I kind of got in touch with through a different route. I applied for a PhD straight out of uni just because it was in a subject I was interested in. I didn't get it, but it created that research link. And actually, I've ended up on a kind of a really exciting pathway that I've really enjoyed. So everything happens for a reason. And Venora still can't get rid of me now, and it's nearly 10 years later. So, here we are. But I mean, I say that because I think kind of something I've been asked to talk about is challenges. And I think just getting in touch with people and finding your research link is absolutely essential. As a clinician, you know, I've done 2 fellowships now. I've done a Wellbeing of Women entry-level scholarship for midwives, which took me out of clinical practice 1 day a week to start finding what I wanted to look at, what the research would look like, supported by Venora. And I also did a Masters of Research within that. And then I was, after that, subsequently successful and getting an NIHR pre-doctoral clinical academic fellowship, which I finished a couple of years ago now, which I really enjoyed. And that was full-time research, kind of building the evidence base, developing myself as a professional to get those skills that I didn't have in the world of research. But I think the kind of key to that has always been to have that network. So often people say, oh, you did them at I was at University College London Hospital, which is a big central London hospital. That's where the funding is. But actually, everybody can do these. And you, as even at UCL, I was one of the only midwives doing research on my own. So it's, even though these big hospitals have fantastic research reputations, when you're an allied health professional, often you are the only person doing it, or at least leading research projects. So it can often feel a little bit like you're working on a one-man band, which is why I think having a research network is essential. So whether that's reaching out to people that have done work in the area and making those contacts, or finding other people in similar positions, that's definitely been one of the challenges, and how we've kind of overcome that. So yeah, I think other things that we all find is imposter syndrome, and that would be one of the challenges I think I would be advocating for. If anybody asks me about my research experience, I always say you feel like an imposter, but actually there's a massive network out there, and there's what you're doing is important, and it's kind of about having that self-belief and reaching out and putting yourself out there and being brave to go and apply for those research fellowships, or apply for that Masters of Research that you might be interested in. I often say this to Venora, and I think Venora might have said this to me in the first place, but as clinicians, we're really good at saying we work in an evidence-based way. We know that we work in evidence-based. Everything we must do is research-based. But why are we not the ones doing the research? Often in midwifery, especially, we find that it's really rare that midwives do research. And why is that? Why aren't we the ones doing the research? So I'm always keen to come to things like this and get on my soapbox and talk about how important it is that we're all doing research as clinicians, as researchers, and as these clinical academics, a little bit of both. And that's been my story so far. So we're still kind of planning to move that forward, just working out which direction. But yeah, it's going to be hopefully woven into my career throughout. Thank you.
Thanks, Anna. Hopefully this is better now I've ditched the headset. Excellent, thumbs up. Thank you. And that's a challenge. And I noticed Ali agreeing with you there about why are we not all doing research, and why are we not leading on our own disciplines. So you've put down a challenge to us, which I'm sure there'll be some good questions for you coming forward. Okay, Ali. Ali is our next speaker. She's a registered dietitian, and she works as a health and wellbeing lead with the Ministry of Defence, Police, and she is a doctoral student at King's College London. So over to you, Ali.
Thank you so much, Venora. And there was a lot of nodding through Anna's input there, because I resonate a lot, particularly with how did I even get here talking about my research journey. I think especially because for me it started relatively late in my career, and has been shaped by a combination of professional experience and academic development, as opposed to just being, purely interested in academia from the start. And I say that because I joined the police service at 18, and very much wanted to pursue a more tactical vocational career at that point. And I quickly became interested in the impact of shift work on health, well-being and performance, and how I performed on shifts. This interest ultimately led me to study human nutrition whilst I was still serving in the police, before taking what felt like this leap of faith in my early 30s to retrain as a dietitian. And that's how I know Nadia and the Council of Deans of Health during that journey. In something of a full circle moment, when I graduated, I began working with the Ministry of Defence Police, supporting the occupational fitness and well-being of officers, alongside a team of military nutritionists and physiologists who have a strong research background. So this is sort of how my journey started to take shape. Research became integrated into my practice because it was a culture of the team as well, through the implementation and evaluation of occupational health and fitness interventions, as well as supporting a physical employment standard study. So it's been very different to sort of my background and my training. Through these experiences, I became increasingly interested in how research can be used to address real world challenges faced by, in my research, shift working populations. So in 2023, I commenced a part-time PhD focused on health monitoring and free living shift working police officers. The project uses a mixed methods approach, combining both quantitative and qualitative data to understand the health impacts of shift work in operational policing. And the later stages of the research will use a co-production approach to develop and pilot bespoke real-world interventions that are both evidence-based and feasible within a shift working policing context. Looking back, my pathway into research has not been a traditional one, and I think that's the point, and Anna touches on this, in that research journeys aren't linear and they may be unique. It's developed through professional curiosity, exposure to supportive research environments, opportunities to connect practice-based questions with academic inquiry. And that experience has given me a strong interest in how we create accessible and suitable research pathways for others who may not necessarily see themselves as researchers at the start of the career. I definitely resonate with that. So what got me interested? Well, crucially, it was seeing firsthand the reality of shift work in policing for me during both my time as a police officer, but also supporting officers in the MOD police. I saw colleagues working long and unpredictable hours, often under significant physical, psychological pressure, became increasingly interested in how these working patterns affect health, well-being and performance. And as I progressed through my studies in nutrition and later my dietetic career, I realized that many of the challenges experienced by both police officers and other emergency service personnel are widely recognized, but there's still important gaps in our understanding of how we best support these populations in a real world setting. So that sparked my desire to contribute to the evidence base myself. As Anna says, we are in these environments, we see the challenges day to day. Absolutely, we should be the ones that contribute to that evidence base that ultimately support others and improve practice. So I do have a number of roles, so I wear a number of hats. So I'm a dietitian, I work in the Ministry of Defence Police, I work collaboratively a lot across the police service, and I'm also an Army reservist, and then obviously fulfilling requirements for my part-time PhD. In terms of support, I've been really fortunate to work in environments that value evidence-based practice and recognise the importance of research. In the military team in particular, being surrounded by colleagues with strong research backgrounds, I've certainly benefited from that academic supervision, opportunities to connect my research directly to real-world occupational health challenges. But I would say there's been barriers, and I think it's important to be totally transparent, particularly on the policing side. Culturally, I would say leaders crave regular, quick, tangible outputs. It's very much how that industry runs, for want of a better phrase. So the commitments and academic process of a PhD are not always fully appreciated, because particularly doing a PhD part-time, you're talking 4, 5, 6 years for an outcome. By then, the senior leaders have rotated 2 or 3 times and don't really understand what I'm doing and why. So there's a constant justification for the purpose of my research. So to finish on sort of points that have helped and supported me, I'd say for me, the most helpful supports have been flexible pathways into research, particularly coming from a more vocational background and mindset. Supportive supervisors and colleagues have been key, and employers who recognise the value of research alongside professional practice. As someone who came into research later in my career, being able to undertake a part-time PhD while remaining embedded in practice has been crucial. And looking ahead, I think protected time, mentorship, and greater recognition of practitioner researchers would make a real difference. Many people working in frontline professions have important research questions, but they need the opportunity, support and confidence to translate those questions into research careers. Thank you very much.
Thank you, Ali. And I think there's a lot of resonance there with all three speakers around the importance of flexible pathways, but also the importance of recognizing those transferable skills that make healthcare practitioners so good at research. Thank you. So again, please do put questions in the Q&A for Ali. Our fourth speaker is Isaac Sorinola. Isaac is Professor of Physiotherapy, and he's also the Deputy Dean Education in the Faculty of Health, Medicine and Social Care at Anglia Ruskin University. Over to you, Isaac.
Thanks, Lenora, and thanks. I'm really pleased to be here and to be part of this event. For me, and it's been a pleasure just listening to all the different lived experiences of people. And it reminds me of where I was, where, all the things that have been said just reminds me of where I have been in my past life and some of the challenges that I've faced. They certainly resonate with me a great deal. Maybe not necessarily my own lived experience, but also the lived experience of people that I've worked with at different times in my career. For me, my interest in research started back in Nigeria when I was doing my BSc. I love innovation. I love new things. I love finding out how things work. And I remember when the time came for me to do my BSc dissertation, I remember that whilst we were doing my electrotherapy, which is, I'm a physiotherapist by background, I should say that. I remember while on one of my sessions, one of my earlier courses, I came across a novel technique that had not been talked about, that we don't use clinically. And they talked about how fantastic it was. And I felt, why is there no evidence for this? And then I went on to want to explore that. It's called zinc iontophoresis. It's such a, even now we don't talk about it. And then that sort of helped me it's sort of the opportunity to go and investigate something that is quite novel was just the buzz for me there, even if I don't find anything out. But the fact that I'm just going to be there investigating something that's really novel, nobody knows about. Each time I talk about iontophoresis, it was ooh, what's that? And then I had the opportunity of telling them all about it and the great work that I'd done. So it provided me that project, provided me the opportunity to utilize novel ideas and solve local problems. And that was the beginning of my career into research and research practice. I went on to do a master's, and whilst I was doing my master's in Nigeria, I did that in Nigeria as well. One of the most prevalent conditions in Nigeria, well, certainly within physiotherapy practice, neurological practice, is stroke rehabilitation. Stroke is so prevalent, it's still prevalent, still one of the largest cause of adult disability worldwide. So rehabilitating people and providing people's opportunity to recover is still one of the holy grail that we're all looking for. So when I was doing my master's, that was my direction. So I, again, in keeping with me always looking for something that helps to solve local, provide local solutions for solutions to local problems, I investigated the impact of balanced rehabilitation, a locally sourced, just weighing scales to improve balance performance in patients who can't walk properly, and it improved patients' balance during my PhD, my master's project. And thankfully, after that, I started a PhD in Nigeria. But whilst that was going on, I got the prestigious Commonwealth staff scholarship to go into my PhD at King's College London. And that was just one of the best things that ever happened to me, coming to the UK to do my PhD there. Everything was new. I came just using a computer for the first time. Having a computer to myself was in itself excitement. And I absolutely enjoyed my time there doing PhD, learning, going through things that I had not come across before. I learned skills in physiology. I learned skills in neurophysiology, in rehabilitation, clinical trials, management, publication writing, and critical writing. one of the areas I want to quickly mention this, one of the things that I found out is that despite the fact that I was a first-class student, I was a high-achieving student, when I came here, one of the things that I struggled the most with is writing critically, critical writing. And I struggled and struggled until I got that under my belt. And sometimes one of the things that people struggle with in going into research is the includes the necessary skills like critical writing, being critical in the way we see the world. That's one of the basic ingredients that sort of helps us to move on in our research career. So I just dropped that. So I came and did my PhD, and I graduated and went on to postdoc. And being an international student, I had to get a job. That's one of the other challenges that one of the bottlenecks that face international people when they do come into the UK to study. You know, you've got to get a visa, you've got to get be able to get a postdoctoral post. And thankfully, when I finished, I didn't get a postdoctoral post. I got a physiotherapy lecturership position at King's College London. Now that was good in the sense that it solved the visa problem, but it was not that good in the sense that I had to teach, I had to lecture, I had to do all the other non-fun stuff, I would say. Teaching is good, don't get me wrong. But I wanted to do research. You know, that's one of the reasons I came to do a PhD. But then of course I've got to be a lecturer as well, and that itself place a limitation on how quickly I can go. And I know quite a lot of people who will be lecturers who are sort of struggling to continue to do their research. So I do empathize with that. And some of the things that I've done, I'll highlight it here in this talk. So as I continued, thankfully my PhD supervisor was there, and based on the back of my PhD, we applied for a postdoctoral project fund from the Donnell, who gave us gave us a funding to continue my PhD work. So I was a lecturer, but I had funding to continue the PhD work. So we brought in a research associate, and I was sort of like the person leading the research. So that gave me experience of project grants management, project leadership, and having a research associate attached to the work that I was doing. That was really that really escalated my learning and development. As time goes on, some of the problems that happen in the UK is reorganizations of departments. Keep moving the chairs around and things like that. And so it meant that I had to move around and be divorced from my primary supervisor because she went somewhere else and I went somewhere else. And that limited my capacity to continue research. But that didn't stop me. What I did was I then went outside my institution to find another mentor in another institution. So I met this lovely researcher at Imperial, and then we continue researching. And one of the ideas that I researched, I'll tell you how I came across them. It was one day my wife went to do on-the-ball course. She came home and she started talking to me about it. And I said, there's no evidence for that, is there? She said, well, they said there was evidence. And I said, well, I don't think there's evidence. And then I went to talk to my friend who was at Imperial then. I said, can we have a look at this thing? I don't think there's evidence for it. And that led to a whole raft of research. We did neurophysiology, we did TMS work. TMS is transcranial magnetic stimulation. We were looking at the brain. We are looking at the activation of the brain when people sat on balls. We're looking at what happened with postural control. And we had quite a lot of publication on the back of that. Moving on from there, I went on also to begin to explore the National Institute for Health Research, looking at funding to support work. That's another area that they're quite magnanimous. The rules have changed now a little bit. There are 2 stages. Back then, it was 1 stage where you apply for funding to research problems that will have a patient benefit. And the idea is to have patient benefit within 5 to 10 years. And so because I was looking at this strong training for people with stroke, they funded it. And then I got this NIHR grant, which again gave me an opening into the NIHR pathway. And that's another area that I can suggest to as many lecturers who are interested, who've got or clinicians, who've got research ideas, who've got problems in the clinic that they feel that a bit of research will enable us to understand what's going on and be able to develop interventions that can have patient benefit. So, that continuing for that. And then form on the back of all these different things, collaborative work with other people outside the UK sort of enabled me to continue to build my profile as a researcher. And then I had PhD students who also came with brilliant ideas. So if you're out there, you've got ideas linking up with senior researchers who can work with you to enable the actualization or the development of those things are things that I will recommend. Master's projects are also things that are also beneficial in sort of building that portfolio of publications, portfolio of research experience, methodology are things that can help boost the profile, that will enable you to get the grants that will help you in moving on. I'll quickly talk briefly about some of the things that are available out there. I love the NIHR pathway. The NIHR pathway, particularly for clinicians, is one of the things that we cannot ignore. We can't ignore it because it provides a pool of money that will support health-related research that will have patient benefit in the not too distant time. I currently sit on the postdoctoral NIHR panel that looks into people who are after their PhDs looking into improving get research fellowship funding to develop their independence in research. And so we see lots of applications from people who are immediately post their PhD or people who've done PhDs for a long time and they're looking to develop independence. They put in the applications there, and the NIHR supports a huge amount of health and social care researchers as well. There are also local networks as well. I know the Community for Allied Health Professional Research. That one is also there, where it's a hub, and they have different hub in different areas, so you can look them up. There are 12 regional consortium around the UK, and so you can go there for things like networking, peer review, research training, mentorship, funding applications, collaboration, or even dissemination of your research findings. So that generally, lends itself well for allied health professions research as well. There are also the UK research, UKRI funding stream as well, particularly for people postdoctoral who are looking to develop that independence in their practice to apply for funding like that. There are quite a lot of opportunities out there, and exploring them will be something that I will greatly encourage people to do. Now, I'll just quickly round up by saying something about some of the challenges that I faced, because it won't be complete if I don't say some of the challenges that I faced as well. Some of the challenges, one of the things that I told you earlier about the fact that getting a visa, particularly because I was an international student, a international postdoctoral student, that was a challenge, and that still is a challenge, particularly because you will find that there are limited permanent postdoctoral positions in the UK, and the fact that because it's small and there are many people with PhDs looking for those posts, the competition can be very stiff. I was lucky in the sense that I got a lectureship. So either you go for a postdoctoral position or seek lectureship. That could be one option as well. And the challenge that's also there, or the bottleneck, another bottleneck that you see, is the fact that there's a publication driven culture where I remember when I finished my PhD, one of the things that I quickly became aware of is you publish or you perish. And I think that's still something that is vaguely true in the sense that most of the things when you apply for funding, they're looking at your list of funding, list of publications to determine what proportion of it is a first author publication, so a last author publication, and what's your own contribution to it. So whatever you do, ensure that you continue publishing, the work that you do. And it's also important to ensure that there are no gaps. Make sure you're publishing at least one thing a year to ensure that there are no gaps in your publication records, because those things, they sort of enable you to have a good profile, particularly when you're applying for funding. Salary constraint is also something that's also possible. That's a bottleneck for me. Then I was married. I had 2 children at that time, so I couldn't go for a postdoctoral, post, because the money on offer was just not going to be enough for us. And so I was always looking for something that was going to be able to meet our needs in the immediate future. And so those are kind of challenges that it limits what you can get or what you can't get, what you can go for, what you cannot go for, and things like that. So by and large, I've been lucky or blessed, I would say, with my career trajectory to date. And I know that there are opportunities out there. There are people that will support people that are interested in pursuing research. It's just finding those things, developing the network, and going to those research conferences where you keep developing and growing your network that will help in moving people forward. So I think I'll stop there and allow more discussion. Happy to answer any questions that you may have.
Thank you, Isaac. And you put some good information out there, which I've added a couple of the links to the chat. I'm aware that this is a 4-country, so you mentioned the NIHR Academy, and that's obviously sits for England. There are similar opportunities in England, Wales, and Northern Ireland. And again, looking at some of those opportunities is really important. We do have a few questions here, so I'm going to start with our first question. Actually, is for, hopefully I haven't lost it. Where has it gone? There we are, Rabiska. So Jill has asked, she said, good luck with this, but she's particularly interested in how you make the concept of research less scary, because let's face it, it is pretty scary when you start out as an undergrad. So how do you make it less scary?
Thank you, Joe, for the question. Yeah, I did think about it, and definitely it felt scary. And I think one of the things that I find in common with a lot of students in my cohort and when speaking to other disciplines as well, is this preconceived beliefs, because our professions are very underrepresented in research, and we don't really have much opportunities to be involved. When you think about research, a lot of students said, and myself as well, I thought it was just like people who are amazingly academically brilliant, top of the class, white coats, research is something that's done in labs. So all these like preconceived ideas that we had. So maybe in the beginning of the research module, I'm thinking what would help me. As healthcare students, we go out on placements, and I'm sure like a lot of us see some problems and think, oh, why is it done this way? Or would that work better? Some ideas like that. To include that practical element, to encourage those discussions in the theory, in the lectures itself, I think that would really make it, because you can then visualize, okay, that is a problem. And if I'm doing something about it and something hasn't been done and I can do something, I can take a step towards it. So I think that would pick up their interest, as well as Anna said, during a dissertation, she found something that she's really interested in. So that would have made it less scary for me. Also, Professor Isaac said, attending research conferences, if there's any of opportunities in the university or beyond, if the interested students can be informed about it, whatever's happening in the university. Opportunities like research placement. As much as I enjoyed the research module, and I scored the highest in my cohort, so I really enjoyed it. But even though I did well and I enjoyed the module, the theory side of it itself, I don't think I would have continued to pursue something in research, like further go beyond doing masters in research, if it wasn't for the research placement and the internship. So that kind of gave me the practical exposure to see what it's like, more than just coming out of theory, like qualitative, quantitative data and methodologies and sampling, just what instead of words in your that you have to learn for your assignment purpose. I think there's so many wonderful initiatives from organizations like the NIHR, Burdett Trust in Nursing nowadays, to develop early career researchers. And as undergraduate student, I had no research background, nothing to do with research previously. And what you don't know what you don't know. So some in the research module, if these factors, so there is opportunities to go beyond this if you're interested. So having conversations like this, I think that would definitely have helped it make less scary. And when you can visualize yourself doing it, and when you can see, oh, I could do that someday. And especially as if you could invite, like, I found when I went back to present to second year students, that was truly such an amazing experience, because I know that my cohort would have definitely benefited from that experience as well. So if you've someone from your discipline or cohort who then went on to do research nursing or in your respective fields, and went on to pursue something in master's or PhD, and if you invite the alumni back to share the experiences, I think having that personal connection and seeing that, oh, they went through the same experience as I did and now they're here, so that can definitely make it seem more achievable as well.
Yeah,
that's for
so
me.
helpful. That's so helpful, and definitely so true. I know that when I go and speak to students, then they're not nearly as interested as if Anna comes along and speaks to them. So, it's so true, bringing somebody back that's from their cohort that they can relate to, that brings it back to life. Thank you, Rabiska. We have a question for Anna. So somebody's asking, you're now 100% clinical, so who is paying for your research time? And I think that's a big question, isn't it? How do we get research time when we're working 100% clinical?
Absolutely. I kind of said that at the start because I think it for especially in midwifery, I'm sure in the other allied health professions, but 100% clinical is like what we're familiar with. That's our kind of buzzwords. So as I said, I've had a couple of fellowships which have been brilliant, kind of entry-level fellowships and NIHR fellowships who have kindly paid for my time and given me that protected research time. And when I came off the end of that, I did think, oh, well, this is it now. I'm back to being clinical all the time. But it's almost a change of mindset. So yeah, 100% of my time is paid for by the NHS. Absolutely true, but I've still published whilst working here, and I've still had bits and bobs going on, so I'm really lucky, and we all should be, because it is the direction of travel in the NHS that my manager is very flexible when it comes to having if there's bits and bobs that I want to be getting on with, and if I can facilitate it within my time or my study time, then that is what I do. And my manager is very supportive. I keep it realistic. If I said I've got I want to write a paper, can I have a week off? I think I'd probably be lucky. I wouldn't have a chance. However, building it into what I'm doing is how I've done that. So the paper that I've published on was on a project that I was working on directly as the clinic sister. That's the kind of work that I've been doing. So building research more literally into my clinical role. Yeah, I guess it's about using your study time. It's about talking to other people in the area and making sure that we are just building that research into our jobs now, rather than just having it as separate entities, which is also, having these fellowships is brilliant, but it's not always hugely sustainable. I'm not going to lie and say that I never do it in my spare time, but I am also, as a clinician working in the burnt out NHS, fiercely protective of my personal time. So, you know, if I'm going to do it in my personal time, I try not to do too much. I have to be mindful of myself. So it's kind of a bit of a balancing act, really, building it in where I can into my clinical time, using my study time effectively. Lots of hospitals have pots of money available for study, and I'd strongly recommend people getting involved in that. And it may not be all of the time. You know, if you want to go to a course, it may not pay your time to go on all of it, but to allow you to go and to pay the course fees is quite often happens. So use what's available within your clinical role, and you're being 100% clinical doesn't mean none of those percentages are research.
That's really helpful. Thank you, Anna. And Robiska mentioned Burdett. You mentioned well-being. I've dropped those 2 links in the chat for people. So thank you for that. Ali, one of the things you mentioned was that people don't understand about you doing research, why it's needed. How do you cope with that when people are saying, well, why do you need a PhD? How do you cope with that?
Similar to what Anna's just described, actually, just to jump on that, in that it's about being smart with integrating my research into my day-to-day job and selling the benefits of the work we've done so far. So as context, when I first moved into the MOD, primarily working with the MOD police, my primary effort was implementing an occupational fitness program that we iteratively developed to adapt to the needs of my shift working police officers, and then evaluated that, submitted those reports, and that sort of formed the foundations of the proposal for my research that I'm doing now. But it is really challenging, particularly in industries like defence and policing, because senior leaders move around every 2 to 3 years. So a part-time PhD, which is 6, 7, 8 years, you know, by then I've potentially had 2 or 3 different senior leaders that I've got to justify my research, and just keeping it as practical as possible has absolutely been key. I really struggled at the beginning to hit that balance, because I suppose I was still coming off the back of other research programs and also trying to do a proposal and start the PhD pathway. And of course, as we all know, there's certain milestones of a PhD that you need to hit, which I was naive to. You know, I was just in my own head, because I've come from that culture. It was a case of, this is what I want to do, this is what I want to look at, this is my research question, this is the concept of what I want to create. I just want to crack on and do it. But I've had a mindset of, well, I've also got to make sure that I fulfill the requirements of the PhD and meet the need of my upgrade from MPhil to PhD. I've got to publish a certain amount of papers. I need to present at conferences. So, and all of these things I found frustrating in those early stages, but actually, once I've achieved each milestone, whether that's running my pilot study and writing a feasibility paper and looking to get that published, but then the lessons learned from that feasibility is informing my day-to-day, and that is getting the buy-in from the organization. So for me, it's been pulling through those key learning points, appreciating actually this process of a PhD of research is there for good reason. It's got to be systematic. You've got to do X, Y, and Z, and the organization has to accept that. But by being able to feed in, well, actually, I've done my feasibility study. Here's some key lessons learned that will have impact nationally for anybody looking to research in this population. This is what we're going to do now as a result. That's helped with that process, but it's still a tricky line to balance, particularly being a practitioner researcher. And I think a lot of people will absolutely appreciate that on the call today.
Yeah, absolutely. Really good points. And I think it kind of links in a little bit to what Isaac was saying about publish and or perish. You've got to publish as you go, and you've got to be getting that information out there as you go to ensure that people are still engaged.
Yes.
Now I've got, sorry, go ahead. I've got a really tricky question, and I'm going to start with Isaac with this tricky question, and then others can add to it. So an anonymous attendee has asked me, have you found, how have you found the support from universities? So in the current climate, we know that they're cutting costs and they're putting research maybe a little bit on the back burner because of that. They're really having to focus on education. How do we kind of make sure that research stays within there and keep that support going forward. So Isaac, do you want to take that one first?
Yeah, thank you. Thanks for that. I mean, it's always going to be a challenge in terms of the current climate that we are all in the UK in particular. And it's not only unique to the UK, we're also seeing it in Australia and the US, where education is significantly challenged by, because of funding changes and rule changes and things like that. Universities also vary in terms of their focus. There are the research intensive ones, there are the teaching focused ones, there are the research informed ones, and they vary in terms of their focus. And so some institutional research is still research led. And the driver is still for every lecturer to ensure that they are publishing and they are getting the research money, and to ensure that there are different systems within the university. I know every lecturer researcher will always want to have more time to be able to do research, but then of course the support in universities vary depending on their focus, like I mentioned, and therefore so it's optimizing that support that's available in whichever university each person finds themselves. So it's not only, we don't have to do a one-man research. Of course, postdoctoral, the more interdisciplinary research is, the better it is really. So it's finding those networks within institution, focusing on local problems that we can focus our research into, being politically savvy to look at current local problems in the health and social care space that we can direct research to. Although having said that, there's also the need to investigate problems that we don't even know right now that are future facing and things like that. So for me, I will say there's still support in universities, but of course it's not like before. It's ever dwindling because of the challenges that we all know too well. But I will say that there are still opportunities for us to work together interdisciplinarily to ensure that as we put all our best efforts into contributing to moving the research agenda forward, because without research, we can't really improve the quality of our lives, the quality of our patient outcomes, the quality, we can't even be efficient in terms of the way we utilize our resources, because spending money on something that will not work, you might as well spend that money on something that will work, once you find out what that thing is. So, I don't know if I've answered that question, but that's the way I think about it.
I think those really good points, and making the case for why research is important is really key. You'll see a feedback poll has come up. Please do respond to it. We've just got a few minutes more. I think also just in relation to that, we've got a real driver now for universities with the Research Excellence Framework coming up. 2029 will be the next assessment. That's how often universities get their money. And if you're interested in that, we have a webinar on that at the same time next week on Tuesday, June the 9th at 12 o'clock, and you can get a catch up. Thank you. The webinar has just been dropped in the chat for you there, and you can get up to date in terms of REF and all things REF, hearing from Joe Rycroft Malone. Now, I'm just going to ask each of you really briefly, because we've only got 5 minutes, what your one takeaway tip would be for individuals wanting to get into research. So if I want to get into research, your one takeaway tip. I'm going to start with you, Rubiska.
One tip from my undergraduate experience is, if you feel like, and when I started in the beginning, when I started for research placement, I was scared because I didn't think like, oh, I don't have much experience, I don't know if I should go for it, but I'm so glad I went for it. If you think if you think you don't know much about research but you're interested in it, go for your internship, go try to arrange your placement opportunities. I would say get in touch with your local trusts, R&D departments, and reach out to your university lecturers. If you're in them, I'm speaking as a student from a student's perspective, but reach out to your university lecturers, maybe research module leads, if there's any opportunities in the universities. Yeah, NIHR, again, at the organizations, they are doing quite a lot in terms of supporting undergraduate students get into research. So yeah, try to look at opportunities. Thank you.
That's great. Thank you. Anna, briefly, please.
I would say if you find a paper that you're interested in, drop the author an email. They will be delighted that you've read it and will be happy to talk about it, and may even be the start of your research career.
Fantastic. Thank you. Ali?
Mine goes without saying, but it's, if you can, choose a topic that you genuinely are passionate about, not just an interest, like have a real passion and it can integrate into what you do day to day, because like the PhD research journey is absolutely challenging. And sometimes just the thought of what I'm doing is really cool for me, and the opportunity to have impact is what drives me. So that would be my top tip.
Great, thank you. And Isaac, last word.
I think that I'll go back to what I said earlier when you asked me that question, and it's sort of, get in touch with people who are of the same mind, and you learn off them. I'll go to research meeting in the university, research conferences and things like that, where you can get insights into what's going on, and then potentially networking opportunities that will begin the beginning, that could be the beginning of a research journey.
Thank you. We've had 4 fabulous speakers sharing their experience today, and thank you for joining us to hear about how to get into research, some tips and lessons, how to overcome the challenges. We've got 1 question's just popped up in here. Oh, it's a thank you. So thank you to you all from everybody. We've really enjoyed your time today, and please do follow the Council of Deans website. We have other webinars, we've got blogs, we've got fantastic panels going on. So there's a lot happening in June, but thank you for joining us.